Good afternoon, this is Dr. Do again. This video is on alphabetical list of problems due on C. Today I'm going to talk about the coarctation of arteries. The arteries means either aorta or some other arteries, or carotid artery or renal artery or mesenteric artery. Coarctation is a term for, it's a fancy term for narrow or strict. Constricted. So, but is there any situation that warrant emergency visit? Yes. For example, if the coarctation of the aorta can have the complication of the torn or dissection. So if that's the case, you feel sudden burst, sharp pain on the chest. If you know you had the condition, or probably you did not know, usually you should. By the time it's dissected of the endothelial tissue, you probably already know you had it. But if there's a sudden burst chest pain, so that's probably the sign for aorta dissection. Go to the emergency room. Or the long-term chronic renal artery stenosis may complicated by the renal failure, high blood pressure, eventually cause many problems like the blood pressure sky high, causing headaches, or even can cause a stroke, or the long-term hypertension cause coronary artery disease or cause the heart failure. So these are all the emergency signs I've mentioned before, either heart failure or stroke, or acute renal insufficiency or renal failure, because a long term of renal artery stenosis cause a lot of problems. So that's the end stage complications. If that occurred, anuria or oligonuria or edema and associated with heart failure, chest pain, or chest beat irregularly. So those are all the possibilities of the complications from the coarctation of the arteries or stenosis of arteries. So then if any of them occurred, that is the sign for emergency. So let's talk about the first of all, coarctation, constriction of the arteries. It's not like the coronary artery disease. You had the inflammation caused the plaque because of lipid deposit, the inflammation on the endothelial cells from the plaque with calcium. This constriction usually for the aorta coarctation usually is just the narrow passage. The passage is narrow and also constricted and lost the flexibility. So this kind of artery, the pathophysiology of this coarctation of the aorta, it's like the long-term hypertension, increase the pressure resistance to the heart, so-called the heart failure is the most common complications. Again, like the aorta endothelial dissection is also possible because lack of the flexibility, either from genetic or from subtle unknown degenerative, or the inflammation of unknown cause this constriction, narrowed passage of aorta. And others like the renal artery stenosis usually is genetic, could occur in young people or could occur in older people, usually diagnosed at early stage, especially for those at young age had hypertension runs in family. So if probably did all the workups, eventually find out the renal artery stenosis. So what is the significance? Why the renal artery stenosis cause so much problem? The renal artery stenosis because decrease the perfusion to the kidney and cause the hormone, the endocrine associated endocrine hormone abnormalities, the renin, angiotensin, aldosterone. This is a cascade of hormones. Three of these hormones are very important, either in the blood pressure regulation or the electrolyte regulation. For example, the angiotensin that's the major hormone can increase blood pressure. So if you know the ACE inhibitor is angiotensin conversion enzyme inhibitor, it's work to block this enzyme. If the kidney artery stenosis cause this, the kidney get a signal, oh, I did not have enough perfuse, so triggered the blood vessel constricted and secrete the renin and then angiotensin and aldosterone. So to preserve water, to increase the blood pressure, eventually cause systemic problems. In addition to the kidney problem, will cause the systemic, like hypertension, heart failure. So that's the significance of this narrow of kidney artery called renal artery stenosis. In terms of carotid artery stenosis, usually is caused by the plaque, the blockage from the thrombosis formed on the endothelial lumen side of the blood vessel. So that's of course I already talked about if the carotid artery narrow down stenosis cause the problem, increase the risk of ischemic from the either ischemic of the brain tissue or the thrombosis or the thrombi falling off and lodged somewhere in the brain, cause the ischemic stroke is a possibility. The other artery stenosis is the vertebrae artery stenosis. This artery is the one running along the cervical spine. So if the cervical radiculopathy can complicate this vertebrae artery stenosis, which has the consequences of the short-term loss in, like the short-term or transient ischemic attack. So these are all the possible artery stenosis. Some of them are genetic, some of them are from the long-term degenerative, or some of them, two of them I mentioned here, like carotid and vertebral, are from either thrombosis or from the pressure of the local tissue inflammation. The canal is getting narrowed. So this is the consequences of each of these is very serious. So how to diagnose this? In addition to the emergency signs, how to diagnose it? The coarctation of the aorta mimic the symptoms of angina associated with exertional chest pain, because during the exertion, so the blood supply is not enough, so cause the ischemic. So the symptoms mimic the angina. So if you have the exertional chest pain, go to the physician. Even though it's not emergency, go to the call your physician, and echocardiogram or any other image study can identify this stenosis. And the renal artery stenosis is usually diagnosed by either the ultrasound can tell, or the other image study can tell the stenosis of blood vessels. In terms of the treatment has to be managed by the physician. There's no way. There's a criteria for the either surgery or either put a stent or just watch closely. And if you're diagnosed of any of these conditions, I'm sure your physician will tell you, or either to follow or either refer you to the blood vessel surgeon or the angio surgeon to do the surgery, or cardiac specialist. So this is and there's another one I mentioned before when I talk about abdominal, is the mesenteric artery stenosis. Usually those kind of problem occur in the older people. It's the symptoms like abdominal pain associated with food intake after probably 70 years older or even older. And this kind of ischemic cause the postprandial abdominal pain, and during the exam it's negative, but the pain is kind of severe impair the food intake and the malnutrition. So these I have talked before. So these are the coarctation of arteries, and fancy word for stenosis, or narrowing or constriction of the arteries, either by usually when the coarctation is used, it's not referred as the thrombosis or the emboli. It's just the blood vessel wall getting constricted. So anyway, so this is on the letter C. I just wrote here the take-home message is for the coarctation of the aorta or renal artery stenosis. If you have the exertional chest pain, could occur in young people. Both of them, hypertension in younger people. If you have this kind of problem, call your physician or go to emergency room to check it, to make sure to exclude this kind of problem, or to diagnose and start treat and follow up regularly. Thank you for watching. I will see you next time.